Hey, welcome back. So I just wanted to continue to talk about how keto or carnivore will not most likely cause you to have a heart attack. Now, I can't give you a guarantee because years and years and years of poor diet decisions will cause you to be something in my will cause you to have long term effects that you didn't expect. A lot of times when people change diets, they automatically assume that this is what happened. I got on the keto diet and I had a kidney stone, or I got on the keto diet, my thyroid, all of these things, but you have to understand the mechanism. And as this channel goes on, you'll understand why some of these things might happen, but it may not be what you think. Anyhow, I wanted to talk about today how I'm a nurse. I'm a visiting nurse, so I go house to house to patients, and I look at their medications and I open their cases and educate them. And what I found is that many patients that have been discharged recently, over the past year or so, have been recently discharged with Jardians. Now, when I asked them, okay, are you a diabetic? What's going on? Tell me why you're taking Jardians. They're like, my doctor just told me that it will help me with my heart failure. And I said, do you know what Jardians does? They're like, no. I said, so I tell them, Jardians is a diabetic. I'm so sorry about moving the camera around. Um, Jardians is a diabetic medication, and the mechanism is it helps to excrete excess sugar through your urine. And so, big long terms, all of that. I do have a class that I am completing and breaking more things down in a better way. But this is meant to make you understand physiologically the simplicity of it all. And when you begin to start putting together the puzzle pieces, you'll understand how this all will make sense. So I'm just giving you little bits and pieces, things to think about, things to make you think for yourself and even question the doctor. So they're giving these patients Jardians, um, and not giving them the education to decrease the sugar and carbohydrates, and that they would have improvement too with their heart. Um, they're telling them take the Jardians and they'll send them home on a low salt diet. And sometimes these patients have what we call hyponatremia, which means they already have low sodium. And so they're giving them this medication that's going to cause them to pee more and pee out the sugar, as well as when you pee more, you also excrete sodium. And so, and then telling them to eat low sodium, as well as giving them a sodium pill when they have found that they're hyponatremia or have low sodium. So it's kind of frustrating as a nurse to see this interesting dynamic that I have to teach these patients. And so I just refer them back. I say, well, listen, according to the American Heart Association, they're saying that for a man, you're only supposed to have 9 teaspoons of sugar per day, and for a woman, 6 teaspoons of sugar per day. And they call it natural sugar, whatever, because whenever anything hits your tongue, you have something called amylase that breaks it down. If it's a carbohydrate or a sugar, it breaks it down into sugar, and your body doesn't know the difference. Insulin is coming out, and insulin, when it comes out, it doesn't play well with others. We'll just leave it at that for right now. But the frustration is they're not telling the patients to cut the carbs and cut the sugar, and your heart will be improved. They're still harping on low sodium, and patients are dang near dying because sodium is an essential nutrient. The same with protein. Whenever you put protein in your body, it goes to work. It builds your blood, it builds your immune system, it builds your skin, it builds everything. Very little is left over. So you won't have to have fiber even to get out the junk, because your body has utilized most of the stuff. Now think about this in contrast to a carbohydrate. When you eat a carbohydrate, an apple, say, you have fiber in this apple that you cannot digest. So your body is going through this thing where it has to get rid of the stuff it can't use. The little bit of minerals, if there's any, or vitamins in it, is very hard to utilize. Because if we're eating anything out of season, where are we getting it from? If it doesn't have a seed, what is it? And if it could be if GMO, if it's coming off of a truck, it's being shipped from hot places, and all the nutrients are not there. And so then the insulin has to come out to get rid of the sugar that's in it, metabolize the sugar. It's a lot of work to utilize that little bit of vitamin that's in a fruit. And so when we think about the difference between our use of protein, which is the essential building block of most of our cell, the mitochondria, the brain, every immune system, even your blood and your bones. And we're saying get rid of it. It does not make sense. And then when you blame salt for what the carbohydrate did, it's a problem. Remember, for every 1 gram of carbohydrate, your body holds onto 4 grams of water, carbohydrate. Excuse me. And so we need to be very mindful of what's really going on and how our body is metabolizing these things. Physiology is physiology. You can say, well, I need this variety and I need to get my fruits and vegetables and all of that stuff in, but it's a lot of work to get those nutrients. And meat, most of the nutrients you can find in meat. Herbs might be a little different. Certain herbs can be healing and all of that kind of stuff, but meat mainly is, especially the heart. I mean, think of a heart as a muscle. Protein builds muscle. And so blood. So let's just think about this physiologically and make it make sense. That's just a little bit, but like I said, my frustration was the fact that our patients are being prescribed Jardiance for heart failure, not being told to cut the sugar and cut the carbohydrates. And they're just going with it. So if you have a family or a loved one that needs to hear this, please share this video. Please let them know. I do have a class. I do have a group. I do have support. The class I'm still working on, but I think I'm going to go ahead and release it this week and just keep adding to it. God bless you. Thank you for watching.